I'm Dr. Amol Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the United States to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today we're speaking with Dr. Carla Spagnoletti, not only an accomplished academic physician, but somebody who's training the next generation of academic clinician educators and leaders. Dr. Spagnoletti is a professor of medicine at the University of Pittsburgh. She has a unique focus in the field of medical education, focusing on the patient-doctor communication, the patient experience, and mentorship, for which she has received numerous national awards from the Society of General Internal Medicine, among many. She currently oversees 11 fellows as the Director of Academic Clinician-Educators Scholar Fellowship in General Medicine, and oversees 30 postgraduate students in a role as the Director of the Master's and Certificate Programs in Medical Education at the Institute for Clinical Research Education. Thank you so much, Dr. Spagnoletti, for being on with us today.
Thanks for inviting me.
Dr. Spagnoletti, I'd like to start by talking a little bit about your childhood. If you can walk us through your journey and any major events that have helped shape your path.
Okay. Well, I can say that I wanted to be a doctor from a very early age, probably 9, 10, 11 years old. It was just sort of this idea that I had in my brain that wasn't necessarily shaped by any particular event or any specific interaction with another doctor or with the healthcare system. There aren't any doctors in my family, but I really liked science, and I think that had a lot to do with that early desire to become a doctor. I think for a while I was convinced that I wanted to be a forensic pathologist. Not sure if that was because of TV shows that I saw or the fact that my father, now retired, was a detective. But it's funny that I ended up not becoming a forensic pathologist, and probably the complete opposite in a way, because I interact with so many different living people, both with my doctor hat and with my educator hat. I just knew that I loved to be in the academic environment where things are fast-paced and where there's a multitude of resources, and most importantly, resources in the form of trainees, so students, residents, fellows, and faculty who are all around you and really just wanting to constantly learn.
Can you expand a little bit on mentorship and how students, residents, fellows can really connect with mentors and have more meaningful dialogues, impact on life decisions, not just clinical decisions?
I really think that most people can benefit from multiple mentors that have different roles in their role as a mentor. Obviously, it's very important for students and residents who are doing any type of research, whether that be basic science research or clinical research or medical education research, so on and so forth, to have one or more project mentors that can sort of show them how to do it right, how to be methodologically rigorous. I have mentors who I have met with on a very regular basis, and other mentors who I've only met with once or twice, depending on the needs. And then the other really important type of mentor is a peer mentor. I think that peer mentors don't get enough credit, or the idea of peer mentoring doesn't get enough credit, because I think that peers are really an invaluable resource for being able to bounce ideas off of them, to collaborate with them on initiatives, tasks, projects. And, sometimes they're in a better position to understand where you're coming from or the types of problems or challenges you're facing. And for the most part, I work at a place, and hopefully many of you work at a place where colleagues are really rooting for one another and really excited about the success of others. And so if you're in that type of environment, rather than a very competitive environment, I think that having, 1, 2, or more peer mentors as part of your mentoring network is really essential.
Some individuals are very open to developing this network of mentors versus others who really are not able to have that mentor network, apart from maybe some professional affiliations, but really nobody that they have meaningful dialogues with on their personal or professional life. What have you noticed between the two types of individuals in terms of differences in their personalities or behaviors?
I think it's more about behaviors rather than personalities. I think that folks who are, a little more on the quiet side, shy side, introverted, it may be more difficult for them to find mentors, but it's possible. And the differences that I see between having mentorship and not having mentorship, it's really about how successful or how productive that person is. I think it's very, very difficult, especially in academic medicine, near impossible, to be successful in that field without being a well-rounded academician. And in order to do that, you have to be excellent clinically, but you also have to be productive from a scholarship standpoint, including developing teaching products and conducting research studies and publishing and developing a national reputation, going to other places to talk about your work. And all of those things, all of those activities are really rooted in having someone to guide you. And that's true no matter what stage of your career you're in. And so folks who want to be in their own bubble and chug along and meet the status quo, they may be perfectly happy not having mentors or not having many mentors. But those who really want to keep their career path moving in a forward direction, those who are ambitious, those who really want to get promoted, take on leadership roles to really make a difference in their field, I think that those folks are the ones that you'll see who have a really great mentoring network or great mentoring team behind them.
So you're not only mentoring students and residents and fellows, but you're also mentoring mentors, faculty. What do you find in this difference between mentoring individuals who are the end customer of mentorship versus those who are the medium of mentorship in developing them to be stronger mentors to pass that on to the end customer, which are the students?
One's role as a mentor sort of develops organically, and it's really common when you're early on in a mentoring role that you doubt yourself and that you really kind of have imposter syndrome and thinking that you aren't equipped to do a good enough job or that you might fail your mentee. And I think that vulnerable time is really where having a mentor to mentor you is really important.
I read a very interesting article you had written in the Journal of General Internal Medicine, RESPECT Respect, about 10 to 12 years ago. Can you talk to us a little bit about respect and any tools that you talk to students or residents about that helps them maintain respect in their communication with patients?
I do think that especially at some point in residency, it is important to refocus on some of those softer skills or those people skills. I really think that teaching folks how to communicate is just as important as teaching folks how to manage diabetes, for instance. And there's lots and lots of literature on how good communication skills improves patient safety, patient quality of care, the patient experience, and even some that show improved morbidity and mortality. And so it is a really important facet of learning how to be a doctor. And so I do think that having that as part of the curriculum in both medical school and residency is essential. And in terms of teaching trainees how to respect patients, I don't know that I necessarily would say that they need to be taught how to respect patients. I think that it's important that all of us as doctors see our patients as unique individuals who have unique and diverse backgrounds. And it's really important for us to meet them where they're at and to be non-judgmental and to be open-minded in making sure that we can provide the best care for them, but still be sensitive to their needs. And so I guess all of that, it gets rolled into the concept of respecting patients. But I think that good patient-doctor communication includes respect, but includes so much more.
Can you share with us any tools or tips that you recommend we think about on a day-to-day basis to help us become more respectful and better communicators with our patients?
I think that there's a few things. I mean, this isn't something that I developed, but I know that it is implemented both in my institution and others, in that even that first opening line of a presentation where you may say, this is a 45-year-old female who presents with abdominal pain, to tweak that and say, this is a 45-year-old avid gardener who presents with abdominal pain. And so kind of asking or requiring almost trainees to get in the habit of incorporating something personal about that patient in the very first line. Obviously, it means that they have to ask those types of questions in order to get that information, but by putting it into the very, very beginning of the presentation, it really sets the stage that, okay, we're talking about a person who has a lot more to them than just abdominal pain. And sometimes those emotions are subtle and sometimes those emotions are overt, but they're their emotions. And our jobs as physicians are to hear them, understand them, and if there is anything in our power, to help them process those emotions. And it's very important to not only acknowledge that there's always emotions that come along with any patient's history, and that it's our job to seek those out and to understand them and handle those emotions just as much as it's our job to elicit biomedical information from them.
So as a master clinician educator and having taught many students, what are the traits and habits of your most successful students that you've trained?
I would say that there are probably several, and not every successful student or resident or fellow has all of these characteristics, but ones that seem to pop up in successful trainees more than less successful trainees are probably a sense of curiosity and the ability to be self-directed and satisfying some, at least, of that curiosity. I think that organization is really, really important as a marker for success in one's role, especially as a doctor. And I think students who work on their organization and perfect those skills before they move on to the next level are really setting themselves up for success as an intern and as a resident. I also really admire those students who strike the right balance between being confident but not overly confident or arrogant, if you will. And along those same lines, students who know what they don't know and know when they need to ask for help. I think that it's really, really dangerous to have a student or a resident who doesn't acknowledge or really can't even tell, doesn't have the insight into what they don't know. And I always tell my students to make sure that you ask somebody or that you bounce your ideas off of somebody if you're not sure. And I guess the last thing that comes to mind is how much of a team player that person is. Being a team player tends to very highly correlate with successful students and trainees, in my experience.
What are some tools that we can use to develop ourselves, to move up that scale and achieve in developing these traits and habits that you've mentioned?
I think it's really important for students to not only set their own goals anytime they enter a new environment, a new experience, rotation, elective, clerkship, whatnot. But it's also really important that they find out from those they're learning from. But I also think it's important for students to realize that they're going to be working with lots of different people, lots of different residents, attendings. Each one of them has their own idea of what that secret recipe is. And so I think it's really important when they start working with someone new to try to sit down and have the opportunity to talk with them about what types of things they're looking for in a student, or what types of things they expect of a student, and try then to periodically elicit feedback as time goes on in those areas from the resident, from the attending, to see how they're doing or how they're being perceived in terms of those characteristics.
If out of all the things that you've talked to us about, if I were to ask you to pinpoint on one thing that you would really advise young physicians like myself, something you've learned over time, what would that be?
A lot of times it takes putting yourself out there and allowing yourself to be vulnerable or potentially rejected, depending on who or what you're reaching out for. That means expanding your network in terms of finding mentors, expanding your network in terms of finding people to collaborate with on tasks, initiatives, projects, and just expanding your professional network by trying to get to know other people who are interested in things that you're interested in, or who do the type of work that either you do or that you aspire to do. And so for those of you who are listening who are still in medical school, it's not too early to start. It really isn't. And it's one of those things that, you'll thank me later for this pearl, I hope.
Dr. Spagnoletti, this has really been amazing. I'd say out of all the things that you've shared with us, a couple of things, really stand out. One is to reach our peak potential, it's our responsibility to build our network of mentors, of the people that we work with. They could be peer mentors or senior mentors. And in that process of building this network, we have to be willing to face uncomfortable situations, face rejection, because that's really the only way we're going to grow. I'd say the second thing is the process where we sit down with these individual mentors. And one of the tips that you gave is at the beginning of our rotations, proactively set goals and then proactively elicit feedback as a way to develop and further strengthen some of the traits and habits that we need to become successful. And I'd say the third thing, and one of the quick fixes, is to incorporate something personal when we present a patient in the first line. Something that you mentioned now is adopted at a number of different universities, but is definitely very powerful in helping us focus on the patient as a person. So I really think that these are some, along with so many things that you've shared with us, and I really appreciate your time. This has been great. Thank you so much.
And thank you for the opportunity to talk with you today. This was really great.
To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the masters in medicine.